Alright, today we are going to demonstrate how to flush a central line. Mr. Smith here has a implanted port. So what we would need to do is first assess our agency's policy, making sure that we have all the appropriate supplies. So then we would need a 10 ml syringe of normal saline, heparin, if that is what our agency's policy states we should be using. We also need alcohol wipes or scrub hubs, and a pair of clean gloves. So we would obviously make sure we have client privacy, identify our patient, name and date of birth, check for allergies, and explain to our patient that we need to be able to flush his line just to maintain patency. So every 4 weeks or so, if it's not being used, we need to flush it. Or any other times in between, if it's being used, it needs to be flushed as well. We'll make sure that we don't have anything sitting in the line, that kind of thing. We don't want any blood clots forming or that kind of thing. So that's why it's important to make sure that we are flushing the line. So first we need to do some hand hygiene. And put on our gloves. And then we are going to take an alcohol wipe here, and for 15 seconds we are going to clean that port off. And then we can unclamp. And then we would take our 10 ml syringe, make sure we have got no air in there, and attach it. And then we would aspirate back for blood return. And it looks like we got some blood return there, which is good. So then using push pause, we're just going to go ahead and flush Mr. Smith's port here with 10 mLs of normal saline. All right, take that off. And then this is also then where we would, well, we're going to wipe that for 15 seconds. And then this is when we would go ahead and flush with the heparin per our agency policy. And then if we use that, then we would also then again 15 seconds with that alcohol wipe. And then if our facility uses the caps, then we would put that on there, make sure that we reclamp everything as so. And then we would go ahead and dispose of all of our stuff, get rid of the gloves, garbage, hand sanitize, and then we would document what the site looked like. We would the time, if there was blood return, we would document how easily it flushed, if there was any issues. If we weren't able to get blood return, we could have the patient kind of move around and get things to kind of shake up a little bit there in hopes that we could get blood return, but we had good blood return on that. Yeah.